Hi everybody, so I'm Evelyn Prodger and I'm chair of the Community Hospitals Association, and we're really pleased to have Julia Wood with us this evening to talk about joy in work. So I know Julia is going to introduce herself and she has a presentation to run through, and then there'll be plenty of time for kind of questions, comments, either raise your hand or pop a question in the chat and we'll keep an eye on both. So over to you, Julia.
Right, good evening everyone. What I'm going to do is share my screen, so just bear with me while I do that, and hopefully can you see that? Oh no, I haven't pressed share. That's caught me out twice this evening. So you can now see my screen, is that right?
Yeah.
Yes, we can.
Lovely. So
Sue, sorry, Sue's got her hand up. Are you okay, Sue?
Yeah. Oh, sorry, I haven't touched anything.
Ah, well, technology for you. If someone does put the hand up, if someone could let me know, and then that would be great because I can't see everything. So, thank you very much for inviting me along this evening to talk about one of my favourite subjects, which is about joy in work. So, just a little bit of background about me. My background is in quality improvement, so I'm not clinical by background, but I've worked in the NHS and for the NHS for about 25 years, and I've worked nationally, regionally and locally delivering quality improvement programmes and training within NHS organisations. So over the years, I think what became clear to me while doing this work was about the importance of culture and the importance of happiness at work. So that's why I became quite passionate about this topic. Having said that, this is often the reaction I get when I start talking about joy in work. Now, this is because people think, and quite rightly, when Julia doesn't understand how difficult it is to work where I work and to do the job I do. And I would absolutely say that is very, very true. But the thing is, I do think that everyone wants to be happy at work. I do think calling it joy in work can be off-putting for some people, and I will talk about why it's called joy in work a little bit later on. But the point is that I think people want to be happier at work, and you can call it something else, and some organisations do. So just to put some context with that, this is from the Harvard Business Review. Now, so this isn't NHS specific, but
I have to put the force head, so you just mind the phone there, Ravi.
Hi.
Oh, sorry. Hello, apologies.
It's all right, don't worry. Brilliant. So, so this information is from the Harvard Business Review. As I say, it's not NHS specific, but what it does say is that 90% of people expect to feel joy at work, but actually only 37% do. So we have this gap of about 57%. And one of the reasons why this is unfortunate really is because we spend about 90,000 hours at work in our lifetime. So this is 1/3 of our entire lives. So actually being happy at work is quite important. So within the NHS, it's even more so and the reason for that is because purpose-driven work, which many people are in the NHS, increases engagement, but it can also lead to a risk of burnout. And what they've found is that trusts with more engaged staff tend to have higher patient satisfaction, with patients reporting that they're being treated with dignity and respect. So that's really important. But high levels of stress are associated with errors that can harm patient care. And actually, in the acute sector, it's been associated with higher levels of mortality. I couldn't quite believe that when I first came across it, but it is actually, research has shown that it is actually true. The other thing is, people talk an awful lot at the minute about incivility, but civil environments really matter because they do reduce errors, reduce stress, and they do foster excellence. And stresses at work can lead to anxiety, anger, unethical behaviour and poor decision making and chronic exhaustion and burnout. Now, when I'm talking about unethical behaviour here, it's not because people want to do the wrong things. I think a lot of this is because people are busy at work, so they're having to cut corners. I think the other thing is the systems in place mean that people have to do some workarounds. So when I talk about unethical behaviour, that's really what I'm referring to with that. And there's more, really. So chronic work stress for us as individuals is associated with cardiovascular disease, hypertension, heart attacks, addictions, cancer, diabetes, and even more severe mental health problems, including depression. And of course, then there's also compassion fatigue. So those most at risk of compassion fatigue are those people who work in medical and mental health provider organisations who caring for patients day after day. And the other thing is stress is contagious. So if I'm working in an organisation and around a team and I'm stressed, other people can consciously or unconsciously pick up on my stress, and then as a result of that they become stressed. So that applies as well if I'm happy. So if I'm having a good day and I'm happy, people pick up on that. So our emotions are actually contagious. So we need to be careful about that and think about that when we're working within our organisations. And the NHS, and this won't be any surprise to you whatsoever, but in the NHS, the most reported reason for sickness absence is anxiety, stress, depression, and other psychiatric illnesses. Oh, I should have clicked those. So, and I wanted to share with you about micro stress. So I don't know whether you've come across this before, but this is where we get lots of stresses throughout the day. And so these can start before you even leave for work. You're in your car going to work and the traffic's busy, so you're late for work. Then you can't find a car parking space. Then when you get into work, you want to put on your PC, do that while it's waiting to load up because it's taking ages. You go and make some coffee and then you find, I don't know what it is about the NHS, but there's never any spoons. So you find that there's no spoons, and then all these things are all small micro stresses. And this is even before you've even started your day. Now, individually, these aren't a big deal. Collectively, they become a big deal. So I think it's just being mindful of that. And we're hardwired to focus on negative things. So that's really depressing, isn't it? So we can have a good day, but one bad thing's happened and we think about that all day. And when people ask us about our day, we say, oh yeah, we've had a good day, but we launch into that, not the good things which have happened throughout that day. So our starting point is quite hard. I think when we're looking at trying to be happy and have more joy at work. Now, what I want to share with you today is 2 approaches to joy in work. So the first one is called 15 seconds, 30 minutes. Now, we're not going to get too hung up on the time scales within that, but basically, this is a real simple approach to joy in work. It was developed by Professor Rachel Pilling. She is an ophthalmologist at Bradford Teaching Hospitals, and Dan Wadsworth was a manager there. Now, he's not working there at the moment. He's doing other things, but he's still one of the founders and very much involved in this approach. So I'm going to share with you a video which is going to talk about what this is, because they can explain it far better than me. But before I do, the other thing I wanted to mention was this other approach. So this is the IHI, so the Institute for Healthcare Improvement. If you haven't come across them before, they are the international gurus of quality improvement, and they developed the IHI framework for improving joy in work. And this is where that terminology of joy in work was coined, really. Now, people in this country don't always like it, but people call it other things. So, for example, Newcastle Hospital calls it what matters to you, and there's a reason for that, and we'll come on to that. But East London Foundation Trust call it enjoying work, just to try and make the name a little bit different. And what this does, though, this is an organisational approach to enjoying work, which again I'll talk about a little bit in more detail. But we've got two contrasting approaches. So we've got the IHI framework, which is from an organisational perspective, and then we've got 15 seconds, 30 minutes, which is just for anybody who wants to improve where they work. So I'm going to see if this video works. It's only for a minute or two. So here we go. So what I wanted to say about this as well, they have a website. If you were interested in this approach, they've got all the presentations and everything on there about how to run a workshop on this approach. And also, if you wanted further information, do just let me know and I can talk you through it in a bit more detail. But no, we won't play it again. But what they do is they have these things which are called missions. So I've just got 4 of them here so you can see the principles kind of behind it. So a mission regarding replace would be about as simple as filling the photocopier paper when that's empty, so it saves time for somebody else. Update, and this is my kind of, I think there's some music going on. If they could pop themselves on mute, that would be great. I think there's still some music going on.
I don't know whether you can go on mute.
Right, it's gone quiet, so I will continue. So an update mission is my favourite mission, really. It's about having your telephone number on your email signature, because I ring a lot of NHS organisations and it's just great if I can get straight through to people without going to switchboard. Simplify is about, just an example is about picking up the phone instead of sending an email. And quick check, an example of that is just to check that you've logged out of a PC so the next person can log in quite quickly. So these are really small ideas, but can have quite a nice impact on other people's day. So then we move on to the IHI framework for improving enjoying work. So it has these 9 areas. I'm not going to go through them all today, but I will touch on some of them. But what you can see from this framework is that we've got senior leaders. They're responsible for all of the elements of it. We've got managers and core leaders who are responsible for, I think, 5 elements of it. And then as individuals, we have a responsibility as well. Now, although this is an organisational approach, as for those of you who are team leaders or who work within a team, you can focus on this as from a team perspective. You don't have to look at it from an organisational perspective. So I did just want to make that point. And again, if you've got any queries about this, so we'll talk about some of the elements of it, but you know, feel free to contact me and I can talk you through it in more detail. Fundamentally, what this approach is about is removing what the IHI refer to as pebbles in your shoes. So it's those daily frustrations, you know, those frustrations which we all have every single day, which we never manage to kind of do anything about. This is about having permission to do something about it and speaking to the right people to do something about it. So it's kind of, and collectively as a team, looking at how we can address some of these issues. So how do you get started with any of this, really? So the idea is that you start off by asking people what matters to you. Now, you don't have to be a team leader to do this. You just need to work within a team. So it's saying, what are the challenges? what makes a good day here and what gets in the way of us achieving that good day. So they tend to be the two key questions I ask, and then you identify those, and then collectively you make a commitment to work on these areas as shared responsibility. Now, the IHI suggests using improvement science or quality improvement to test these approaches, but actually many of these things which need implementing or changing don't always require that. It's just about thinking about different ways of working. So sometimes, again, if you're working within a team, sometimes people to try and get a baseline really will do a questionnaire to some of the team, particularly if you work in a big team. And this is just an example of some of the questions you might ask. So I'm not going to go into all of these in any detail. And this is just an example of some of the questionnaires which I've seen over the years. But it's really just trying to understand kind of which areas you need to focus on moving forward. So just to kind of recap, you ask people what matters to them. So you can do that as a group, you can do that on a one-to-one basis, you can do that through a questionnaire, or you can just have a board up, and whether that's a virtual board or a face-to-face board, and ask people what they think. And then it's about just asking, well, why does that happen? What do we need to do? What do we need to work on to get these frustrations out of our day on a regular basis? So one of the areas within the IHI framework is around choice and autonomy, and there's lots of literature out there which suggests that when we have choice and autonomy over our work, we feel much happier at work. And this document, I don't know whether you've seen it, but it's definitely worth a look. It was developed by the King's Fund, and it has this infographic in it, and it talks about a framework for nurse and midwife core work needs, but it applies to all areas, I think, across the spectrum of people who work within the NHS. And really what it's saying is that we do have a voice, and that we're able to take part in the decisions and our day-to-day work and how we do that. So camaraderie and teamwork is also a big one, and I've just put some questions here within your team. You know, as a team, how do you feel? You know, do you feel that you provide mutual support and companionship? Do you feel that you're part of a team? You know, is communication good, and do you regularly express appreciation for each other's work? And I think one of the things the literature certainly demonstrates that when it comes to work, we're quite ungrateful about work. We're quite grateful about other areas in our life, but actually it's the least grateful place we tend to be, which is really weird because we spend so much time at work. So it's quite important that we express gratitude and we share appreciation with the people who we work with. So it's just, if you don't have that, it's about having conversations about how you can actually make that happen. Now, I'm not saying that's easy, but there are activities and things you can do to try and support that. And then, of course, we have recognition and rewards. Now, cake in the NHS is always appreciated, I think, on any level, but it is just saying thank you. It doesn't take a lot of time, but people really appreciate it. And at the Royal Homerton Hospital, no, the university, at Homerton University Hospital, they do these cards which say you've been spotted. And again, these can be done electronically or face-to-face, and they just say you've been spotted doing something amazing. And it's just to demonstrate that, you know, we are valued. And I think there is something lovely about being appreciated. So I think it's thinking of ways to say thank you and show gratitude, which is really important. And just something really from a very personal perspective from us, we do need to look after ourselves. The IHI framework shows that there are elements of the framework which we have to take responsibility for, along with the organisation and the team within which you work. But one of the key things I wanted to mention here is this bit, which is around self-care isn't selfish. So that's in the top left, and it says note, self-care isn't selfish. And I think we need to remember that, because so many people in the NHS work so hard. And I think because of the nature of people who work in the NHS, we givers, aren't we? We give an awful lot, but actually we need to recognise that to keep on giving, we need to be able to look after ourselves. And there was a paper recently published by the Harvard Business Review, which talks about resilience not being about what we endure. It's about how we recuperate between busy times at work. And I think we really need to take that as a message that we just can't, people just can't keep on giving. As individuals, we definitely need to look at how we manage that. And I'm not saying that's easy. I'm just saying that it is something we need to do, because as you will remember from those areas which I was telling you about right at the beginning, you know, inadvertently, you can harm patients through doing this. So it is about it not being selfish and being viewed as a positive thing within teams. The other thing I wanted to share with you is this. Now, this was developed for firefighters, but I think it's great. So as an individual, I would suggest that you look at this and you think, where do I sit on that? Am I thriving? If you are, that's fantastic. But if you're surviving, struggling, or in crisis, then it's about thinking how you move from that and into that thriving area. Now, I was talking to people about this today, actually, at the University of Sunderland, and they were talking about the fact that they move between some of these stages. And I think that's absolutely true, isn't it? One day you might be green, another day you might be orange or whatever colour. So it does move, but I think it's generally where you feel you sit on that spectrum. I think the other thing is you can use this with teams and say, as a team, where are we? And if we're not green, which many areas aren't, what is there anything we can do to help move us into that green area? So that's just a tool I thought you might be interested in. It's definitely something which I share a lot and I look at myself as well, because, you know, I'd love to say I'm always green, because I talk an awful lot about joy in work, but some days are better than others, aren't they? We are not joyful all the time at work. So it is thinking about that. So one other thing I wanted to mention, so smiling makes us happier. So there's loads of research studies out there which tell us that whether it's natural or forced, it actually causes our brain to interpret a physical reaction which makes us feel happier, even if we're forcing it. So my one takeaway would be this, that everyone needs to smile more. So even when you're walking down the street and you smile at someone who's maybe not smiling, give them a big cheesy grin and see what response you get. They might think you're a bit bonkers, I'm not quite sure, but give it a whirl, because it does make us feel happier. And if you think back to about emotions being contagious, if you smile at somebody, other people are going to react in a positive way to that. And we know that, don't we? That when someone smiles at us, and you can tell, can't you, with people? And I think when someone smiles at us, it does make us happier. So, and I wanted to end with this. Now, nearly end with this. So it's the starfish story. It says, one day a man was walking along the beach when he noticed a boy picking up and gently throwing things into the ocean. Approaching the boy, he asked, "Young man, what are you doing?" And the boy replied, "Throwing starfish back into the ocean. The surf is up and the tide is going out. And if I don't throw them back, they'll die." And the man laughed to himself and said, "Do you realise there are miles and miles and miles of beach and hundreds of starfish? You can't make any difference." And after listening politely, the boy bent down, picked up another starfish and threw it into the surf. And then smiling at the man said, "I've made a difference to that one." And my message to you is that in the NHS, we focus on the big stuff all the time, but the reality is making small changes day by day can have a huge impact, not only to you, but also with the teams you work within. So my question to you is, what will you do now? And what would your first next step be? And that really brings me to the end of my presentation. And I just wanted to say thank you very much. It would be great to have any questions which you would like to discuss. My email is on there as well as my Twitter handle. I post about this stuff constantly. Well, I don't, not constantly, but I post about it on a regular basis. So if you are interested and you are on Twitter, do follow me, and you can and we can link up that way. But anyway, just going back to that, it is really thinking about what are the small changes which you can make today. What are those pebbles in your shoes which you can do? I did an event once and I gave everybody a pebble, and this was in 2018, I think. And someone said to me the other day that they still had their pebble on their desk at work and looked at it and thought about what changes can I make which will help me. So it's just a thought. So either get a pebble or think about what changes you can do. So that brings me to the end of my presentation. So I will just stop sharing, and there we go. And then we can just take any questions you may have.